should be all set.
Think back when you first became involved in the program. What were your first impressions?
When I first got involved with MDFT, I read the literature and I was very impressed with their results in their studies. They were getting fantastic results compared to other treatment models, especially around engagement, retention, and what was most interesting about the program was the longer term outcomes. So we just didn't see, as time went on, from the end of the program, people actually got better further out, which was very interesting because we first started in MDFT in Hartford with what was called the Hartford Youth Project. And the outcomes were compared to other evidence-based models, and they were doing better on all the substance abuse variables. They were also doing better on the family variables. So the outcomes for this model were significant across the board, whatever measure we were looking at, whether we were looking at educational measures, substance use, crime, school attendance, school performance, but especially family functioning and family involvement was very high. And that was a big value for our department, was we have all kinds of families that we work with various mandates. So working with various families, whether it's child welfare, juvenile justice, mental health, was very important to us.
What do you like most about the MDFT program?
I like that they take a real comprehensive approach to the kid and to the family, so that the model is very comprehensive. I think thought of almost everything you could have in adapting the model to the individual needs of any one case. So it's not a cookie cutter model. It's a model where it's based on the strengths of the therapist to bring together all the clinical issues, the adolescent development, the parents' development, their interaction, and the social systems. And the other thing I like about it is they're very well grounded in recovery from substance abuse and understand the public sector kids and families and engage the various systems, as well as high quality training for the therapists working with very difficult cases.
Describe the primary strengths of the MDFT program in the area of treatment effectiveness.
I think the biggest strength they have is they never give up on a family, and they try various techniques on just engaging the family into the treatment process as well as the kid. And they rekindle the bonds between the child and the family, because often these parents have given up the kids, or the kids have given up the parents, or there's conflicts between the two, or the kids have gone underground with their drug use. And they've been able to engage those families and get them talking to each other. So the improvement in the family functioning and in the area of substance abuse, they seem to know how to bring that together in a way to think about treatment. So it gives a guide to the therapist, so they're not just out there winging it by themselves. And so it brings them a structure, a way to think about the cases. And I think that the other piece that they do is they really figure out how the therapy should go, so it's not willy-nilly. The therapist is really thinking through or making interventions based on a scientific model that's been well tested, and put it in the real world and work with real families.
Did you want to change this out of
How many more?